Hi, I'm Siobhan O'Neill. I'm the Mental Health Champion for Northern Ireland.
And I'm David Babington. I'm Chief Executive of Action Mental Health.
So I'm going to use a line actually that I've taken from one of your speeches, David. It was when you said mental health and good mental health is shaped in families and communities. So what we know now, based on the science as well about all of this, is that those early environments that children and babies grow up in, that's so fundamental to their mental health, and those relationships that happen in those early years are fundamental then to mental health and well-being across the lifespan. So I think we really need to start with very early intervention, and I'm thinking about people as potential parents. So even going into the curriculum for secondary school students and teaching them about the importance of relational attachments, about parenting, about those first few early years. And then thinking also about the services that we deliver there and the broader supports that we put in for families in their communities. You know, that's where it all starts. The education system is a huge part of it as well. And then there's ways we can actually teach people to be more resilient. We can give them skills, we can help them become more aware of their own stress response and give them problem solving and coping skills, so that whenever they encounter the stress and the ups and downs of life, that they're better able to navigate that. And I guess that's what we're talking about when we're talking about early intervention and prevention. But there are also groups of people across the population who are at higher risk, particularly, you know, people who live in deprived areas and people who live in poverty. And it's by reducing those sources of adversity and reducing the inequalities across society that we reduce the external pressures and we support people's mental health and well-being as well.
No, I'd so agree what you said there, Siobhan, and endorse everything you said, and particularly that focus on younger people and the early years. I think research has shown that the first 3 years of a child's life are the most important, certainly in terms of emotional well-being. And that family support around the child, not just the child himself, it's the family support around the child and the family, and also those people supporting the family and the wider community. And so I think that impact is going to be so great that all that early intervention work can really make such a big difference to a child's life. And of course that child will become an adult at some stage as well. And so bedding that in at an early stage will save those individuals the problems, the families the problems, but also wider society as well, and all the costs that will come with an individual who isn't in good shape in terms of their mental health and well-being as well. So I think I'd endorse that. But that's having said, talked about the younger people, absolutely right. I think has to be the priority, but we can't forget older people as well. And goodness me, what a hard time they've been having through COVID in particular. And so I think we do need to make sure that it is across society and across our communities and out in the communities, and it's not just hospital based. It has to be courses and people and expertise being shared across the community at all age groups and continuously as well. And there'll be continuous process there of everybody learning as well, using technology, for instance, helping us become less isolated, connecting with people and joining up our communities.